Hello, I'm Betty Casey, editor of Tulsa Kids Magazine, and we're here today with Dr. James Ross. He is a family physician with Ross. I'm sorry, what is the name of your Ross Ross Medical Care? I'm sorry.
That's right. That's
Um,
okay.
I apologize. And we're going to talk about some common things that children are facing, especially during this time of the year with fall and going back to school: ear infections, allergies, maybe respiratory allergies, colds, and maybe how to prevent some of those things and keeps kids healthy during this time. So let's talk first about just allergies and colds. How do you know the difference between an allergy and a cold? How do you know that with your child?
That's a good question. There's oftentimes a lot of similar overlap between allergy symptoms and colds caused by viruses and whatnot. Um, Oftentimes you'll see a runny nose, watery eyes, maybe have a little bit of a cough. You'll see with both of those, both allergies as well as colds and respiratory infections. The thing that typically distinguishes between, let's say, allergies and a cold would be fever, for example. Fever, progressive cough, severe cough. There are different kinds of deeper sounding coughs. Sometimes the nasal drainage in children can change colors from more of a clear to more of a darker green color. And those are kind of the main things. Of course, kids that are excessively fussy, uh, you know, kids that might not be very easily consolable, waking up in the middle of the night, tugging at the ears. Those would be things that I would say would probably be more along the lines of an infectious process rather than an allergic process. And you'll also see in kids with allergies, of course, they're scratching their eyes, rubbing their noses, clear runny nose, sneezing, of course, is another biggie that we see. And there's different allergens at this time of year. Obviously, with the different seasons, we see different pollens and different things manifesting and creating a lot of these symptoms for children.
Okay. And when would you recommend that people go to see their physician if they what kinds of symptoms should they see their physician if the children have those?
Yeah, so I would say that if children are having fever, if children are like I said, if they are not consolable, if they're crying, they're very fussy, tugging at the ears, um, a cough that is really progressing, that sounds deeper. It can sound croupy. It can have different types of sounds there. If a child's having any difficulty breathing or working hard to breathe, breathing fast, faster than normal, having any signs there of what we would call respiratory distress, what we call retractions, where you can see the muscles working extra hard on the rib cage, kind of sucking in and working hard, or nasal flaring. Those would be things that I would want a child to come to their physician for to be evaluated. Mhm.
Okay. And you mentioned tugging at the ear and some of those things. Would that be an indication of an ear infection? Tell me what an ear infection actually
Yeah,
is.
that's a good question as well. Ear infections, basically, what we think of when we treat ear infections is really we're treating what we call acute otitis media. And that's the most common form of ear infection. And an ear infection is inflammation in the middle ear. We're not talking about an external ear infection or swimmer's ear. That's more in the canal. We're talking in the middle ear. And there's usually inflammation that's produced by bacteria. So oftentimes kids will get a virus, have an upper respiratory infection. They'll get fluid in their ears. And that fluid, if it's not draining properly, and in children, it doesn't drain as readily sometimes, bacteria can proliferate, can grow, and replicate, and basically manifest in that fluid becoming infected, causing the ear infection. So that's kind of what the middle ear infection is, or acute otitis media is. And so the first part of your question, like how do you tell if a kid has an ear infection? The most common things that we see are tugging or pulling at the ears. Of course, fever is very common in ear infections. Uh, Oftentimes, I'll see babies that wake up in the middle of the night crying, fussy, just screaming. Occasionally you'll actually have an eardrum rupture, and you'll see fluid or blood tinged fluid coming out of the ear canal. once in a while, maybe, more subtle findings if there's fluid building up slowly. Some maybe at times the children won't hear as well. They won't respond as readily. Maybe they'll be a little clumsy, off balance. That can happen sometimes. But typically you'll see the tugging at the ear, the pressure, pain, and fever, very common.
Okay. And how are ear infections treated?
Another good question. There's different schools of thought behind this. What we have seen over the last 20, 30 years is probably a situation where we tend to overprescribe antibiotics. We treat a lot of respiratory infections unnecessarily. When I say we, I mean just the medical community. And we're in Europe, for example, they do a lot of watchful waiting. They don't prescribe and push a lot of antibiotics for ear infections because over time they typically resolve on their own. But if an ear infection is severe enough to where a clinician feels that it needs to be treated with an antibiotic, typically amoxicillins and the like would be prescribed. Amoxicillins, penicillins, and similar medications, Zithromax, cephalosporins, because that's another brand of or type of antibiotic. Sometimes those are recommended as well to treat the ear infection. But honestly, I think that if a child doesn't look what we say toxic or doesn't look very uncomfortable, doesn't have fever, is otherwise acting okay, I recommend we give it a day or two and see how the baby does, see how the child does. If things are getting better, baby's feeling better, acting normal, we'll bring the child back, relook at the ears, and make sure everything's okay. Because more often than not, these things can resolve on their own. The body, the immune system can fight this infection as well, typically. And so I try to do a lot more watchful waiting in my practice. And I know there's a growing recommendation of that. But certainly if a child is very fussy, febrile, miserable, or if it looks like that eardrum's going to burst, if it's very, very full, that might be an indication to go ahead and put a child on the antibiotic to go ahead and treat.
Okay, that brings me to my next question. What are some common sense ways that we can keep our kids healthy during this sort of time when viruses are high and maybe getting into
Yes.
the winter? What would you recommend that we can do as parents to keep those kids healthy?
Oh, that's great. Coming into the fall, winter, early spring, we're starting to see, we're seeing, of course, a lot of the common colds start to manifest. Of course, you have your COVID still, your flu, you have RSV, all very common. But just the common colds are starting to increase at this time of year. They're seasonal. But I just encourage a lot of common sense with my patients, their families, their parents. I always recommend just good things like hand washing, with good soap and water, good warm water. I recommend a plant-based soap typically. That's very important to do. Teaching your children not to kind of, touch everything, rub their eyes and noses if possible, but you're going to do that. So really you want to keep their hands clean. I recommend really good nutrition across the board anyway. If a child is eating healthier, not a lot of sugar and junk food, if you will, but eating clean, good foods, healthy foods, with even good supplementation. I recommend a probiotic. I think that's great for the immune system. It's great for the gut. It's great for the immune system. A lot of our immune factors are located in our GI tract. Vitamin C, vitamin D. Of course, younger babies, you don't do a lot of vitamin C with, but if a child can chew, they have teeth, they can do a chewable tablet or a liquid, 2 and up, usually 4 and up. You can give them chewables, gummies that have vitamin C. Elderberry is also good to use naturally. Vitamin D drops comes in a liquid. We do recommend vitamin D supplementation for infants on up. And so that's really important. Even things like omega-3s, fish oils are actually quite good for the immune system and for health. Getting enough sleep, you don't think about that, but making sure your kids go to bed at a good time, at a set time, getting plenty of sleep, so early bedtime is important. Things as well, people will like maybe essential oils. Thieves, for example, is a good something to use as well when a child maybe starts to come down with something. You can use a little bit of that. Again, limiting sugar intake, eating clean, being healthy, getting plenty of exercise, getting outside, getting some sun. Those are all things that are very important to health and wellness and developing a good, strong immune system. Of course, try to minimize sick contacts. If you got other people that are sick in the house, you just kind of be careful about that. Don't drink after someone who might have a cold or whatnot. Just common sense things, but it happens so often. I have 6 children, so I've seen this happen quite a bit over the years. So yeah, so those are some basic things.
You have a lot of experience, but that advice sounds like it's something that we all need to follow.
Oh, for sure.
Exercise, being outside,
Hmm.
cutting down on sugar. We could,
Hmm.
as parents, I think, be good role models in those ways for our children. Um, okay,
Definitely.
I think that is probably all the questions I have for today. I think it's been very helpful to be reminded that we need to do that, and also I think to know that maybe these infections and things we can do some things to prevent them. So
Mhm.
as we go into fall and winter.
Mhm.
Well, thank you for your time, Dr. Ross.
Yes.
I appreciate you. And again, you're with Ross Medical Center, family physician, and we are
Yes.
Tulsa Magazine. So thank you for your
Great.
time.
Thank you so much. I really enjoyed it, and I appreciate everything that Tulsa Kids does for the community. So thank you all.
Thank you.